So basically get really good letter recommendations from the specialties that are related to EM.
Definitely.
Great. So we all know EM has the specialized letter recommendation. It's called the SLO. How important is the SLO when you're looking at the application?
Okay, that is a controversial topic. So every program looks at this a little differently. Some programs will ask you for 3 SLOEs. Some programs will ask you for 1. Some programs will look at your application regardless. Our program is kind of in the middle. We want you to have them. We don't want you to stress too much about having them or not having them. One thing to remember is that the SLOE is a standardized letter of evaluation. It's not a letter of recommendation. And residency programs and clerkship directors tend to be very honest in these letters. So having, if you didn't do well in a rotation, or you didn't have good rapport with the faculty and with the residents, and your letter doesn't reflect the best, even if it's an SLOE, that may not be the best letter to have in your application, because it will reflect how you perform in that place. So in that regard, the more you have, the better. Don't stress too much about having 2, 3, especially if you don't have a home rotation at your school. You can do away rotations, but you want to have SLOEs and you want to have good SLOEs. Within that, having a very good looking letter of recommendation from an emergency physician can be meaningful as well. And if that's not something you can easily get, having good letters of recommendation from other physicians that can tell us you work well, you're willing to learn, that may be better than having an average SLOE.
So I guess my question would be, if I knew that I didn't perform well at a rotation, and I knew that the SLOE wasn't going to be that good, should I include it in my application at all? And if you're able to see that I rotated there and didn't include it, how would you feel about that?
That is a tricky situation because that grade and the comments from that rotation will be reflected on your MSPE. So when we receive your Dean's letter, your MSPE, there may be comments there saying that you didn't do well in that rotation. So probably better not to include that letter in general, but if you talk to your dean and you know that some of this information will be included in your MSPE, it's better to just be upfront with that information, mention it on your on your personal statement, or mention it on your interview. And more importantly, mention how you overcame that, how that experience made you better, and how are you going to guarantee that you're going to do well here, learn with all your energy, despite what happened on that particular rotation.
Okay. So this is kind of a broad question, but how to rock a SLO? Like how to just make sure you get a really good one?
To get a good letter, you have to do well. So prepare before you go to a rotation. Read a lot. Read from the right sources. EMRA has really good resources on how to rock your clerkship, and also very good resources on how to apply for emergency medicine. So make sure you read those before you go to your away rotation or to your home rotation. While you're there, keep the best of yourself. Show interest, show enthusiasm. Don't overdo it, because that can also reflect poorly on your letters and on your experience. But be yourself. Do well, study a lot, be willing to learn. Don't get scared of doing procedures. Don't get scared of getting your hands dirty on a trauma, on doing sutures. Try to learn a lot and show that you are willing to learn a lot and to contribute. And that will surely give you a good letter of recommendation.
Okay, perfect. So we went over everything in the application itself. So let's say applications start rolling out and you haven't gotten one yet, but you really do want to match there. How do you feel about applicants sending a letter of interest and just saying, hey, I really am interested in your program. Would you please take a second look at my application?
Okay, that is perfectly okay. Emergency medicine is a small world. So if you send that letter to all your programs, very likely somebody will know. So choose where you send it, but definitely we want to see that you express interest. In our case, we are a newer residency program, so knowing that you're interested in coming here and interested in knowing how to rotate here would be a good idea. But definitely don't overdo it. Don't email every program, don't email every faculty member, program director, and residency coordinator. Just pick a couple of people to let them know about you.
So you think it would be helpful and it would work?
It could potentially help.
Potentially, okay.
If you overdo it, it will be bad.
Gotcha. All right, so what about letter of intent? Like after you've gotten your interview, you really like them and you want to put them as number one, how do you feel about an applicant sending out an email? Hey, I really enjoyed my interview here. I'm going to put this as my number one program.
So as a piece of advice, after you interview in any residency program, you want to send a thank you note. It can be in the form of an email, it can be in the form of an actual letter. Some people send handwritten letters, and it's a lot of work, and you have to pay for postage and everything. But you want to make sure you thank your interviewers for having you there. An interview day is a labor-intensive process, so thanking your interviewers for that, it's very important. With that, some programs actually consider that part as part of the recruitment process. So remember, every time you have an interaction with the program you're applying, that is somewhat part of your interview and your application. So make sure you're nice to everybody, make sure you express your interests, and definitely have some kind of contact to thank them for the time they spend with the interview.
Perfect. So that was the thank you note, but how do you feel about programs messaging you that, hey, you're my number one? Does that change your rank list order at all, or?
For most programs, and definitely for ours, it doesn't.
Does
We
not.
want to hear from you, but remember, it's against the rules for an applicant or a program to ask where the other will put on the ranking list, so be very careful with that. If on your communication you want to mention that you are the first on my ranking list, that is perfectly okay. It has to be voluntary. Now, we know we are on the first place on the ranking list on all your letters. So again, don't overdo it. Make sure you choose appropriately your words and be genuine when expressing that interest.
Okay, great. So I just have some kind of random questions. Can you address the recent paper about the future of EM?
Okay, that has been a big topic of conversation in the specialty. There is a job future in emergency medicine. There are plenty of opportunities. In an area like ours, here at St. Rita's, we are still hiring. Many hospitals around our area don't have emergency medicine physicians. They have physicians from other specialties working in the emergency department. So I would say that some of the predictions may be true and accurate, but you have to individualize the case. So with that, do your best, right? When you go to residency, make sure you rock all your rotations, study hard, start projects. Make sure your CV looks different from other new graduates. Leadership in that is very important as well, right? Make sure you can show that you are a good citizen of your department, that you can participate in committees, that you participate in decisions, and that you don't just show for your shift and go home. Because that makes you a more valuable employee for any department, and that can improve greatly your job opportunities.